Welcome to the Penny May Show. I'm your host, Penny May, and today our topic is about two subjects very close to the woman's heart: knowing our breast and knowing our birth control. We have some very special guests with us today and have some insight on these topics. Let me introduce Dr. Amy Seams.
Hi, Penny.
Nurse Speculum.
Hi, Penny.
And Betty Boob.
Hi.
Thank you, ladies, for coming on our show today.
Oh, sure. Glad to be here. Thank you.
Let me open our discussion today on the topic of our breasts. It would be safe to say that everyone knows someone who has or has had breast cancer. It is the most common type of cancer among women in the U.S. and the leading cause of cancer deaths among women between age of 40 and 49. Betty, you seem to have some first-hand knowledge about breast. What should every woman know about breast cancer?
Thank you, Penny May. First off, women should get to know their breasts by looking at them. They need to look at their breasts every day. By knowing what your breasts look like, you will be able to recognize changes in them. Breasts change throughout your life, and knowing what is normal and what is not could save your life.
Dr. Seams, what type of changes are we talking about?
Well, things that can happen to your breast would include breast cancer, which produces a specialized look on the surface of the breast that almost looks like the skin of an orange. There are some other breast illnesses that might look like a blood vessel that's very prominent that's sticking out on the breast. Other than that, most of the changes are just normal changes that you would find anywhere else on the skin, including little zits and just little blemishes. Those are not the kind of changes that we worry about.
Could you elaborate on a self-breast exam?
Why, certainly I can. Betty, would you mind if I show them how to do a breast exam?
Well, of course, Dr. Seams. Just warm up those hands a little.
Okay. Why don't you stand up? All right. Now, when you look at the breast on your body, you have to realize that this tall part up here comes almost up to the shoulder or clavicle area. So when you're checking your breast, you always want to check up by your clavicle. And then you also want to check under your arm. Now, Betty doesn't have underarms here for us to look at, but when you're checking, you'll always want to check under the arm as well. You check for lumps and bumps that aren't normally there. When we start with a self-breast exam, it's always best to start at the top and then work your way around just like the face of a clock. And if you start at the top and you want to just press your fingers lightly and come all the way down to the nipple area, then come back along the next line and then come back in on another line. And you gradually make your way all the way around the breast, lightly feeling. Once you've done that, you may want to press just a little bit deeper in all those same areas to see if there's anything deeper on the second time when you check. Now, the other thing that you always want to do is, at the end of the breast exam, is to squeeze your nipple to make sure that there's no fluid that comes out of the breast. Now, sometimes fluid will come out, especially if you've had a baby within the past few months. But fluid that comes out of the breast that is bloody, that is a very dangerous sign, and that needs to be checked. If the fluid's just kind of milky or maybe even thick like a zit, that's usually nothing to worry about. But always, if you have any question, you should see your doctor for a checkup.
Thank you, Dr. Seams and Betty.
You're welcome.
I'm sure that is an image we will never forget. We will be right back after this commercial.